Whether you're visiting a dentist for the first time or considering a new one, the more you know about who's behind the chair, the better your experience will be. I'm your host, Eva Shea, and on Meet the Dentist, we feature professionals sharing their expertise so you can feel confident about who you trust with your smile.
It's my pleasure to introduce our first dentist to the show. I have Stephen Davidowitz from New York City with me. Welcome.
Thank you so much for having me.
So tell me a little bit about yourself. Let's start there.
Well, so I go by Dr. D. Name is Stephen Davidowitz. It's a little hard for my patients to say, so we go with the Dr. D. And I'm a cosmetic dentist. I practice in the Upper East Side of Manhattan. I have a true love of smile design. I love clear aligners and the use of porcelain veneers to transform a person's confidence in their smile.
I love the topic of clear aligners, and I think everyone on earth knows what Invisalign is. There are others, though, are there not?
I love that question, and it's for a very personal reason. Invisalign was amazing. I actually, when I started in my practice, it was in 2009. That was a true love because I grew up with a father who's a dentist as well. And he actually was lecturing for a company before Invisalign. It was called Raintree Essex. And they made the plastics. It was rudimentary. You would actually have to make up models with those nasty impressions. And every model was modified so that the tooth would move. And then we would suck down plastics onto that. There were some pliers that we would heat up to cause pressure points. And we would have to kind of guess where that pressure point was. And I was a young teenager, and my first job was working in my father's basement in his office because he did not let me near the patients. And I would use those pliers and heat it up to a certain degree and cause those pressure points. I would suck down the plastics. So I knew everything there could be about moving teeth with plastics. And Invisalign took that and brought it to such a higher level of using computer technology and algorithms to create these. And they spent a fortune on marketing over the past.
Some really brilliant stuff too.
Yeah. But there are other options now, just like everything. There's something novel, and then when it's not novel anymore, and there should be other options. And the reason for that is that there should be autonomy for practitioners to use different things that are good in their hands. And we should be able to choose what's best for us, whether it's a cost basis, whether it's the speed of treatment, whether it's the more predictable results, whatever it may be. So about almost 10 years ago, I decided to create my own clear aligner company, which is a crazy idea. Mm-hmm. And we went really far with it. It was great. And then the pandemic came, and it was a little disastrous, but we're still at it. And we just released something called Modmouth clear aligners, which is I'm a co-founder of and creator. And I still use Invisalign in my practice because that's what I could do. I'm a practitioner. I could get to pick what I want to use per patient. But the dentist that we're selling this to, it's a B2B, they love it. They love the fact that it's owned by a dentist, a cosmetic dentist, because we get it. We get the grind, what we go through every day. Not to put down Invisalign. Invisalign's wonderful, but it's a publicly traded company. So their bottom line is maybe different than the way we see things. The prism is through the eyes of a dentist who's managing a lot going on day to day. And how could we create a system, a clear aligner system, that's great for your patients, but great for you, the dentist?
And how do you compete with Invisalign then?
So I'm not really looking to compete necessarily, meaning it's not like going up against a titan with a pebble and trying to knock down the giant.
Right.
Instead, it's just giving an option out there across the country to my fellow colleagues to have another option with the mindset and the treatment planning of a general dentist. So it's not just an algorithm, it's being developed by a general dentist, meaning there are certain things a general dentist does not need their patient to accomplish when they're straightening their teeth for cosmetic reasons. So if it's a back tooth that needs to be uprighted ever so slightly, it could take 3 months. Patient doesn't want that.
Not necessary.
It's not really that much healthier for the patient. There's no cosmetic benefit. It's just longer, and it's going to cost more. That's one example out of many, but it's just developing this mindset of, and there's so many general dentists that are not in the clear aligner treatments at all. They're afraid of it. They're afraid of orthodontics. It wasn't really taught to them in dental school. It seems so complicated. They just refer it. But we're talking about $100,000, $200,000 of extra revenue.
Yeah.
And probably the most simplest thing a dentist could do compared to the crowns, the fillings, the veneers, smile makeovers, implants. It's so simple because it's all being done for you. You're basically handing over something to the patient.
Also, I think they probably don't want to sell.
Right. Correct.
Or they think that it's going to be difficult
They think
to
it's going to be
sell.
difficult, which is also cool about Monmouth is that with my voice, and I get on webinars and videos, I could show a practice in minutes how easy it is. Basically, how it works in a dental office, as you know, you go in, who do you see? You typically see a hygienist that's doing your cleanings. That's usually the person that gets that like relationship with the patient.
They try.
More so than dentist. Dentist is a little scary. But the hygienist, many times, they're talking about their lives and they catch up, especially once you've gone there a few times. That hygienist, if they look in the mouth and they see there's a problem, there's a solution, right? The problem is crowding, typically, on most adults. So we did a study. 3 out of 4 adult patients sitting in a dental chair, in the hygiene chair, has some form of crowding, which means like overlapping of the teeth, which means their gums are not healthy, things are getting trapped, they're aging quicker. They're told all the time you have to floss better or you should come in more frequently. But they don't have to say that. All they have to say is, if you straighten that, you're not going to have this problem anymore. And it'll take like 4 months. That's it. You say that to a patient, you give them the problem, but you never gave them a solution. Because a solution is like, floss more. Like, I am flossing, I am brushing, I am coming in every 6 months. But a solution of you straighten them, you're not going to have this problem anymore, is an easy sell.
Have you ever heard the story about how they got people to start buying toothpaste?
No.
It sounds crazy, but when toothpaste came along, they had a terrible time getting people to buy it. This had to be before 1950 or around there.
By the way, I know a lot of trivia when it comes to dentistry, but I do not know this one.
Oh gosh, I hope I didn't invent it. Now I'm. Well, we'll have to look it up and make sure that I'm. So, it was the advertising wasn't working. It may have been a specific brand that the story is about. Because how long toothpaste has to have been around for quite a long time.
Right.
But the way the advertising was going was failing. And so instead of talking about fresh breath or minty mouth, they switched to talking about the feeling of having dirty teeth. And the sales took off. So we'll have to figure out.
Solution.
Yes.
That it works every time. And it's something so simple that only somebody that's in the field could tell somebody else in the field, this is how you do it. So yeah, anyways, that's Monmouth. Super excited about that. And again, I use it tremendously in my office, but I also use Invisalign. I use other ones as well. But it's all for a means of cosmetic dentistry to gain that confidence of a smile. Because what I've learned is that when somebody is not comfortable with their smile, it affects their entire life. And the greatest joy of my profession and going to work each day is to find those moments. Like when I give a mirror to a patient after I did 20 veneers, and they already have a transitional veneer or temporary, and they're already kind of happy, but all of a sudden they break out crying. And there's this like a tiny moment where I'm like, oh, she hates it. He hates it. But it's not. It's about 100%, right? It's not. It's the fact that they're just like, I can't believe this is me, right? But then they come back for their follow-up 2 weeks later, and they're joyous. They're bombastic. Their personality has changed. And there's great stories that I have. I wrote a book about it, but just these different patients and their stories of how what I was able to do for them changed their life.
Okay, you wrote a book?
I wrote a book, yeah. I wrote a book, again, going to the pandemic, but I had a lot of free time because they shut us down because we weren't essential workers, dentists, even though if somebody has a toothache, that's pretty essential. But we were not allowed to go into the office in New York City, that is, unless there was extreme swelling, bleeding, or a combination of the two. Otherwise, we would have to manage it over the phone. And that was for like 3.5 months. So I was losing my mind because I believe even a cosmetic emergency is enough to properly put my PPE on and take care of them. You know, if I did a beautiful case and somebody chipped their front tooth and they're on Zoom because we're all working from home, that's a terrible situation. I should be there for them. But anyways, putting that aside and is what it is.
Our audience won't disagree with you. That's a tragic situation.
It really was. Anyways, so what I did during that time was I started educating a lot more, and I started doing a lot of podcasts. I did a lot of media on news stations, local news stations across the country. And it was all about how can you take care of your teeth when you can't go to the dentist? Like, what are things you could do at home? Love that. And the more I was educating, the more I wanted to get more out there. So I wrote a book. It's called Power of Transformation, How Changing Your Smile Can Change Your Life. That's available on Amazon. And that was the second book I wrote. The first book I co-authored. This one I did all on my own. And it was great. So it's basically about using veneers to transform your smile. But a lot of the book, is our stories. I started with that because I think that's great, because it's so important to understand. It's not just like, oh, I want brighter teeth. It's the fact that it literally could change lives. 2 was a lot of the facts and fiction about what a smile makeover is. So out of the past 17 years of doing smile makeovers, I culminated the top questions and then even the ones under there, and I gave my true responses. So when people come in for a consult, I always say, grab my book. I have it in the front. I'm not going to charge you for it, because you're going to go home. You're going to have a question. It's going to be in that book, and the answer is going to be there for you.
This is why I podcast.
That's it. That's exactly it. The information is key for comfort and understanding. And I love questions. I spend a very long time on my consults, but I know the feeling of being a patient, because even practitioners or patients, we're humans. And when I'm in the chair and I get home, I'm always like, well, did you ask blah, blah, blah? And I'm like, no. So I think that's what's really cool about this book in particular, is that, sometimes people give you 15 minutes, 30 minutes, 45 minutes, an hour for a consultation. This book will probably take a couple hours to read, but it has everything in there, and you could take it slowly. It has before and after pictures and different situations. It was a great project, and I'm very proud of that.
Also, it has the extra benefit of elevating you. As a dentist, people know you as an expert.
100%. And that never hurts. My practice is built mainly with word of mouth, which is great. But to have something out there that's, past my circle on the Upper East Side, and I've had other colleagues say, I give your book out.
What a compliment.
Amazing compliment. I'm like, thank you. And they're like, it helps. It helps us sell the makeover because it makes it accessible, answers their questions. And I only have to spend 15 minutes with them, and I give them your book. So, yeah.
Well, you've helped your colleagues then too.
Right.
So your dad was a dentist, but what about your mom? What did she do?
So she worked in a bank as a teller early on, and then she helped my father out in the practice. So she did the front desk as a secretary. Then they realized it's not so great for their relationship for them to be that close. And then she raised us, my sister and I, and she was stay-at-home mom, as I guess.
Where was that?
I was in Brooklyn, New York.
Okay.
Yeah.
So you're a local boy?
Yeah.
But you live in the city now?
No, so I actually live in Long Island now.
Oh, okay.
Yeah, once I got married, I have 2 children. I have a son who is 14. My daughter just turned 11. But the second that my wife was pregnant with my son, the oldest, she said, we're getting out of Brooklyn, because she's from Maryland. And she's like, I need a lawn. I need grass. This is too busy for us. So we moved out to Long Island. It's a really beautiful place.
What do you do when you're commuting then? How do you spend your time?
I listen to podcasts. I listen to a lot of things. I started listening to Audible, which I'm falling in love with. I could never imagine listening to a book being read to me. It was like I was averse to it, but I listened to an autobiography by, who's that actor? All right.
Matthew McConaughey.
Thank you.
I live in Austin. He's like our mascot.
Oh, he's amazing. And I never realized how amazing he was. And I would never have read his book because he doesn't really interest me. But it was at a free credit, they call it, on Audible. And I downloaded it. The pearls of wisdom from this guy that I never really knew anything about, except for his one line in that movie. So I started listening to books. I do a lot of work as well. I'm on the LAR, so it's not like the subways of the city. I have a room, I can put my laptop down, so I do a lot of work. And between my projects, aside from the office, like Monmouth and managing that and reviewing cases, I could do that on the train. And I also had a TV show for the past 2 years, a local station here, WLNY, called Your Best Self, with Dr. D and Stephanie Simon. And that was a health and wellness show. Obviously, I spoke a lot about oral health, but we spoke about mental health and a lot of things that I've learned in practice. So the way that came about, because that sounds nuts, but the way that TV show came about is that, again, pandemic, but it was a thought in my head that I love talking to patients and I love treating patients and I love their responses and feeling that, a complex of being able to do something so great. But they always ask me questions about their personal lives and their overall wellness. And they would just listen. And I realized I had a speaking voice. And sometimes I would actually go home and research once I was asked something so I could become more proficient in answering those questions. And I kind of loved that. And I said, I have whatever it is, 2,000, 2,500 active patients at a time. How do I, now that I got this knowledge and I have the ability to comfortably feel good giving this advice outside of my field, how do I get that out even further? And the answer was a medium of television, to create a show where we could have celebrities, we could have fun things, but always have it around the body and mind and overall health. And that's what the show was. It was a great project. We just wrapped up the project. It was a 2-year project, and we did 2 seasons.
You do have a nice voice.
Thank you.
Yes, they weren't lying to you. It's true. What other podcasts do you like?
So I love, like everyone else in this country, for some reason, murder. It seems like we're all just fascinated now with hearing murder stories and solving them. I
have little kids, so I can't listen to anything where people get hurt right now because it just is too upsetting. So.
Like you get anxious thinking that...
I just avoid it.
Right.
As soon as I had them, I couldn't watch the news anymore. I just had to turn it off.
I hear that. Yeah, we stopped playing the news for our patients in the office.
They get really wound up.
They get wound up, and my whole goal there is to make them feel super comfortable. The whole look of the office, myself, the whole staff, and my work is just to take away that anxiety. This is a fun place. We're taking care of you. And when the news was on, it was so hard to break that anxiety. So we completely stopped showcasing any news network, even local news, which we had for a while. It's depressing. And the world is a little scary. So we have mostly music, but we also have Netflix. They could pick their shows and things like that.
Is there anything else you do to make it really special in there?
We truly try. So, some patients are always cold. So we have throw blankets for them. We have eye masks that we heat up to help relieve tension. It also hides from the eyes what we're doing. Other people want to see. So we protect their eyes other ways, but they love that. We have hot towels for them to help clean up. Paraffin wax is a great thing because it's a distractor. So they'll be sitting there with their hands wrapped in plastic and mittens while I'm doing the exam. And it just takes away, because the mind can only process, one stimulus at a time. So the fact that their hands are in this sweating up and they know that it's going to feel so great, they're a lot less anxious and they're listening a lot better. And then personalization. The TV is, again, Netflix, music, whatever they want. We have scented candles for aromatherapy. And then I'm just so lucky for my staff. And they stuck with me during everything as far as the pandemic. Everyone's back. They're like family to these patients. So it's a special place. I love coming to the office each and every day.
So is it all cosmetic, or can we come see you for regular cleaning?
So you can. So it's I call myself a cosmetic and general dentist instead of a general and cosmetic dentist. Because even with the general dentistry, I'm looking through the prism of cosmetics. So if I can make something look better, even if it's a back tooth and a wisdom tooth and I'm putting a filling, I want that to look natural. I want it to, when I'm looking at it, nobody else could see it. Even the patient, no, they can't get back there and actually see it in a mirror. But I want it to be as realistic as possible to mimic real life. And with that, by doing that, it helps me when I'm doing the real work, right? The small makeovers. Everything has to look realistic. It's got to match the person, which is, it's different than the typical, I believe, in my field. People get very into their boilerplate, you could tell oh, that's a Dr. B veneer makeover because everything's flat across, and that's just what that practitioner does. I like to talk to the patient for, like I said, like an hour to get to know them. If they're an aggressive, if they like to be a little edgy, or if they're very timid and they're more soft and soft spoken, and it changes how I'm going to think about how these teeth should look for that person.
I know what you're talking about here. And I have a family member who got veneers probably 20 years ago, and everybody went, "Oh no," because she looked like a different person, and not in a good way.
Right. Because it was turning somebody into a picture of what they see as right. So I try to really spend that time, and I'll actually show it to the patients. Like, I'm thinking because you have that little edge, that maybe we should add an edge, right? We should add a little pointiness to the canines, and we should leave a little embrasure space between the teeth because it just gives a little bit more of that edge. And they, more often than not, they're like, yeah, that's me. That sounds good. And it's so appreciated because it's keeping their personality from teeth that they didn't have like that before. There was always a problem, right? Whether it's discoloration, chipping, old cavities, bondings.
The longer I listen to you, the more weird dental questions pop into my head. And it's the craziest thing.
What do you got going on?
I don't know if they're podcast worthy, but so my two girls are 3 years apart, and one has canines that are sharp and one doesn't.
Yeah, that's genetics. Well, two things. One is genetics, or if it actually erupted that way, it's genetics. If
it did.
Other times, some children actually are grinders, which is very interesting. But like young kids will grind their teeth, and they're not as sharp as they used to be. But that's completely genetic. Yeah.
So yeah, she looks like a little vampire.
Right. Yeah. So the options there, obviously let it be for now. But there's minor things like reshaping of teeth that we do. It's just kind of reshaping the enamel, get rid of that sharp point and give it a little bit more roundness. There's bonding where we could add a little bit to the sides of the point and give it more of a curvature. And then later on, there's always a possibility of seeing me and getting a smile makeover. Yeah.
I feel like people probably don't understand that these are things you can get fixed.
Right. Or they are confused by how to correctly fix it without going down a rabbit hole. For instance, with the canines that are pointy, there are some that are seeking just to fix those two teeth. And they try to either flatten them or add, like I said. But now that tooth looks ginormous if you added to it, and they're dealing with chipped bondings constantly. Or when it's flattened, now their bite's not right, and because everything has to function properly too. So I write this in my book about the right amount of teeth to correct per situation. So even though the chief complaint might be one tooth, it's not okay to just focus on that. It's got to cosmetically work and functionally work. And it's different for everybody. I could do a case where it's just 4 teeth and their smile's transformed and everything works perfectly. And for others, I'm like, I know I did that for your friend, but for you actually need 10, and explain why. And a cosmetic dentist, that's the way they see things. They're not going to just try to do a case because it's a case. They're going to say, no, I'm not doing that because for you, that doesn't work.
It's kind of bring me all the way back around to Invisalign. And I think what you were saying, just to kind of close that whole thing out, was Invisalign is an algorithm, and you put pictures of teeth or scans in, and it comes back and says, this is the way and the only way.
They do, but a dentist could still modify it, and it's mostly orthodontists that would, those that specialize in straightening teeth. They have a lot more background with it and confidence to challenge a treatment plan that came back from Align or from Invisalign. The general dentist is either timid to, especially those that don't really do it, to ask for a change because they don't really know, or they may not do many more cases because they just didn't feel comfortable. And that's really the mod mouth difference. We also give them a case and say, this is the way it should be done. But the algorithm that I created or helped create is meant for the general dentist patient and for the general dentist. So it's right for them.
That sounds really smart.
Thank you.
If we want to learn more about ModMouth, where should we go?
It's modmouth.com. That's MODMOUTH.com.
The other wild dental thing that popped into my head was, and it's really weird, My 5-year-old has what I call a shark tooth.
Uh-huh.
And it's like this evergreen tree-shaped baby tooth, extra baby tooth that came in behind her
Wow.
big tooth. And I thought at first that it was her big tooth coming in the wrong spot.
Mm-hmm.
And I brought her in and they said, no,
It
it's
was
just
a
extra.
supernumerary baby tooth.
Yeah,
That's not super common.
it's not.
No. But it doesn't mean anything bad.
She thinks it means she's extra special.
Yeah, of course it does.
Yeah.
Yeah. She has more pearls of wisdom.
Mm-hmm.
So I remember myself, I had shark teeth, but that was permanent teeth coming in behind
Ooh.
the other ones. And I was just like, it's better to chew with.
I want to kind of wrap it up with maybe I feel like people my age, maybe your age and slightly older, including myself, that we didn't really do as good of a job on our teeth when we were kids. Dentists just in general, they did a lot less intervention when we were younger. And so you can kind of look around at people my age and say, oh, your parents probably decided they couldn't afford braces because it wasn't that bad. But today I feel like they almost all get braces. They don't let anything slide anymore. And the standard has really come up. And I some of that's cosmetic, but I also wonder if there are other benefits that maybe we don't think about.
That's a great question. And I'm super proud of how far we've come with prevention. I remember those days where you only got the braces if it was a big problem. And then maybe later teens would get it because, the child was self-conscious and they begged to get their teeth straightened to help correct a cosmetic issue. Today, what we're realizing is that by not correcting malocclusion early on, we can end up with dental problems. Just like adults, even more so for children, if their teeth are too crowded or not in the right position, they're going to end up with more problems as far as cavities and gum issues and things like that. Even more so is temporal mandibular jaw disorder, or TMJ disorder, and sleep apnea. Both of those could be easily solved at a young age by expanding the palate and expanding the arch of the teeth. Why is that? The more space or airway space we have, the less likely we're going to have sleep apnea problems. And the wider the arch and the straighter the teeth, the more support the jaw has. So it really is a great time of seeing, and I can't wait for 30 years from now to see the, not repercussions, but the benefits of this early intervention. But that's the thought process behind it.
That is super important because it isn't just about looking better. Obviously, looking better has its own benefits.
Right. And you will look better, right? So if somebody's palate is a high palatal vault, their face is going to be caving in because it's like a TP shape. And that affects the growth of their bone and how they're going to look. So it's not just a dental issue, it's a whole facial issue that could have been solved with something like a palatal expander. People think of palatal expanders, and that's one of the early interventions of what you're referring to, as just a way of straightening the teeth, but it's so much more. It's opening that airway, it's expanding the maxilla, the upper jawbone, allowing the lower jaw to sit right. A lot of early intervention that I think is going to be amazing for that generation.
Would your face also look different and better?
Better.
Yeah.
Yes. Yep.
It's all connected.
It is. Yeah, and that's why I think of cosmetic dentistry. I used to call it facial aesthetics. I don't do too much facial aesthetics. I'm trained in fillers and fun stuff. But the teeth and the smile have to fit into the body, and it's got to fit into the frame. And the frames of the teeth are going to be the lips and the jaw structures and the cheekbones, the forehead, the interpupillary lines, the ears, everything. And you got to tie everything together. So when we're dealing with early intervention, just putting that together with cosmetic dentistry doesn't really make sense, but it does because you're helping them cosmetically, but you're also not just focusing on the teeth. Teeth, as a cosmetic dentist, teeth are not very pretty. I've had the experience of holding teeth in my hand. During dental school,
I've had that experience
exactly.
as a mom.
You look at it, it's not that pretty.
No.
Like why? Who would think this is? Oh, yeah.
Why do we save these? What?
Sentimental, but smiles are gorgeous. But even smiles aren't gorgeous. our faces. It's the first thing people look at, right? We don't typically look down at somebody.
No, nobody ever says, what beautiful teeth you have.
Right. That would be odd. But they might say smile, or they just say you look great. And that's the biggest compliment, because everything works together in harmony.
Very well said. We know where to find Modmouth. What if we want to come see you as a patient? Where do we go for that?
So you could find us on our website, which is luxurydentistrynyc.com. You can also find us on Instagram at luxurydentistrynyc. And there are a bunch of links there. You could go to our Real Self page. You could also go to our website. You could book an appointment. Many places you could go to learn more about us.
Thank you for sharing your stories today. It's been very enlightening, and I'm very, very glad that you came to see us today.
Thank you so much again for having me, and this was a lot of fun. I'm looking forward to doing this again sometime soon.
I hope so.
There's no substitute for meeting in person, but we hope this comes close. If you're considering this dentist, be sure to let them know you heard them on the Meet the Dentist podcast. Check the show notes for links to this dentist's website and Instagram. To be featured on Meet the Dentist, book your free recording session at meetthedentistpodcast.com. Meet the Dentist is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.